Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. My name is Solange Durand. I'm based at Cochrane, South Africa, in Cape Town, South Africa. Welcome, and thanks for attending this Cochrane South Africa webinar on using logic models in systematic reviews, which is going to be facilitated by Dr. Anke Rohwer. This webinar is being hosted in partnership with the Global Evidence Synthesis Initiative. Anke is a researcher based at the Center for Evidence-Based Healthcare at Stellenbosch University here in South Africa. She is a doctor of public health with a background also in clinical epidemiology and nursing. And she has extensive experience in conducting systematic reviews, developing logic models, and studying how to use them in the context of systematic reviews and health impact assessments. Just a reminder to everyone that we are going to be recording the session, and the video recording will be available at Cochrane South Africa's website, and we will also share slides with attendees. It would be great if we can keep questions to the end of the presentation, and then Anke will address them. To ask questions, you can either click on the little hand icon, which indicates that you're raising your hand, and we will then unmute you so you can ask the question. Or you can post a question in the question box, which I will then read aloud to Anke. So without further ado, I will hand over to Anke.
Thank you, Solange, for the introduction, and good morning or good afternoon, everybody. I think it depends on where in the world you are at. I'm really delighted to talk to you about using logic models in systematic reviews today. And just to say, this is the first time I'm holding a webinar or speaking on a webinar, so I hope everything goes smoothly. And yes, feel free to ask questions at the end of the presentation, and I look forward to it. So before I begin, let me just, no, the slide doesn't want to work. Sorry. There we go. So just to say that my thinking and my work around logic models was really informed by a number of things. So firstly, as work done as part of the EU-funded Integrated Health Technology Assessment for Evaluation of Complex Technologies project, discussions as part of the LIXA group of the Effective Healthcare Research Consortium. We also conducted a workshop on developing logic models at the Global Evidence Summit in Cape Town last year. And then really also my own experience in conducting various systematic reviews across fields and using logic models in those reviews. Just to say that the views are my own and do not necessarily represent the above collaborations, and that I don't have any other conflicts of interest related to this webinar. In addition, we have published 2 papers on logic models. You can see them on the screen here, and I will refer to them quite a lot in my presentation. And I think it might be helpful for you if you want to read up more about the things I talk about, if you want to go and look up those papers. Okay, so what do we want to achieve with this webinar? So I hope that by the end you will be able to discuss how logic models can be used in systematic reviews, describe the added value of logic models in systematic reviews, and then also explain the approach to developing logic models for systematic reviews. What I've tried to do is to sort of look at the more practical side of developing logic models, but I can't do that without talking a bit about the theoretical concept. So I hope it doesn't get too theoretical. I really want it to be pragmatic and practical. Okay, so what is a logic model? So if we talk about terminology, people often say, well, that's not a logic model, it's a conceptual framework or something else, and actually there are a lot of terms being used for the same thing. So especially when we look at logic models within the realm of systematic review. So people call logic models concept maps, conceptual frameworks, influence diagrams, analytical frameworks, but essentially all of those are also referred to as logic models in this presentation and sort of in the world of systematic reviews. A formal definition of a logic model is a graphic description of a system, which is designed to identify important elements and relationships within that system. So importantly, it's a graphic, so it's a picture, and then looking at the elements and the relationships within a system. So I have my own definition that is just simply boxes and arrows that clarify a process or a relationship, a system, or components of an intervention, or anything else that is not straightforward and better explained using pictures. Okay, so boxes and arrows, I think, are quite an essential part of a logic model. So generally and more traditionally, logic models have been used in program evaluation. This is really where they come from. And you might all know the framework that looks at the inputs, the activities, the outputs, the outcomes, and the impact of a program, and really the relationship between these components. And the aim of a logic model then is to clarify the implicit or the explicit theory of change. It also helps to explain assumptions with stakeholders, and it provides a framework for planning, implementation, and evaluation. So more recently, or should I say probably for a while now, more and more authors of systematic reviews have used logic models in their systematic reviews. And not only systematic reviews, but also other types of research synthesis. So HTAs, other types of reviews, they're increasingly being used and being seen as quite helpful. So logic models can be used for any systematic review, and they're useful in any scenario, but they're particularly useful for reviews that are more complex. And just to say that in terms of complexity, we don't view complexity as a dichotomy between simple and complex questions or interventions or perspectives, but it's more of a continuum on a scale from simple to complex. So an intervention sort of can have a certain degree of complexity. It might also depend on the perspective, how the question is asked. So it's not always the intervention that is complex, but it might be the perspective or the context. We'll have a look into the characteristics of complexity in the next slide. So logic models can really be useful to describe the components of complex interventions and the relationships between them. They can help to make the underlying theories of change and assumptions about causal pathways explicit. They can describe the interactions between the intervention and the system within which it is implemented. They can also help to synthesize and present the results and the findings of a systematic review. And it can be very useful to have a logic model to help to communicate your findings with the stakeholders. So as I said, the complexity, the characteristics of complexity can relate to the intervention. So some interventions might have multiple components. There might be a number of groups targeted by the same intervention. There might be a difference in the degree of flexibility of an intervention, and the intervention can change over time. So these are some of the characteristics linked to the intervention. But complexity can also be related to the causal pathway, because there might be non-linear relationships between the intervention and the outcomes. There might be multiple mediators and moderators of effects that we need to take into consideration. There might be feedback loops on the causal pathway, synergistic relationships. Then we need to consider the number and variability of outcomes, or the connectivity of individual components, and also the interaction with context. And I don't want to, as I said, go into too much detail of this, but just to give you sort of a background in terms of how logic models can be used to look at complexity. So indeed, they can help unpack the complexity related to the intervention, but also to any other PICO elements. So maybe to the population, the comparison, or the outcomes, and the context, as I said, the causal pathway, and then sometimes more than one of the above. So it all depends on, where the complexity lies, what aspect of the complexity you want to unpack and clarify in the logic model. So one of the most important aspects of logic models for systematic reviews, I think, that I think is most important, is that it increases transparency. So it just really helps to clarify what it is that we're looking at. and this is just a quote that I took out of one of our papers, because I think it really highlights the important bits on logic models. So importantly, it's a tool. It's a useful tool. It's a tool for the review team. So for the author team, to help them to think through and to make explicit their understanding of the interventions, of the relationships, of the causal pathways, and also of the underlying assumptions about these. So I think this is very important to remember, that it's the author team that's actually generating and developing the logic model based on their assumptions and their understanding of the intervention. So how does a logic model then add value to systematic reviews? Well, it actually is quite helpful, and it adds value to more than one stage of the review. So at any stage of the review, it can add value. So in terms of scoping the review, a logic model can be really useful in refining the question or conceptualizing the question. It can help us to decide whether we want to lump or split the review. And it's really useful in identifying the intervention components and understanding the intervention. Sorry. Then when we conduct the review and develop the protocol, it can be really useful to help develop the criteria for including studies. It can also help to inform the search strategy, and then explore heterogeneity and define subgroup analysis, so or subgroups. It's really useful for that. Then when the review has been conducted and all the data has been extracted, it can also help to make the review more relevant to policy and practice by giving sort of a structure and a framework to the reporting of the results, and then also to interpret the results based on the initial conceptual framework. And in some instances, that framework will even change, and we'll get to the different approaches of using logic models. But in essence, it can be really useful from the beginning to the end of a systematic review. And it really gives sort of a framework and a structure to a systematic review. Okay, so as part of our thinking on of how to use logic models in systematic review, we developed this taxonomy of logic models, looking at various approaches to logic modeling. So maybe just a quick explanation of where we got to it. So when we started our work, we were, most of us came from this really strict systematic review tradition where you develop your protocol, you pre-specify everything, and you would also develop your logic models before the start of the systematic review, so at protocol level. And which would then basically inform your systematic review, but it would not change during the systematic review, and it wouldn't change in light of the findings of the systematic review. So this is really sort of a case where a priori you pre-specify and make explicit your assumptions, and you conceptualize your question, and that becomes your framework to then conduct your systematic review. On the other hand, we have a more iterative approach to logic modeling, where we say that the logic model doesn't have to stay the same throughout the process, because as you conduct the systematic review and as you generate new findings, you can actually adapt your understanding, and you have new understanding of certain things. And why not then incorporate these into your logic model to then present your findings? So I think the big difference between the two is that this one doesn't incorporate the findings of a systematic review, so the a priori logic model stays the same, but the iterative logic model actually aims to then incorporate the findings of the systematic review. This is often used when you do systematic reviews of qualitative research or mixed methods. Yeah. So we then had these two approaches, the a priori and the iterative, but then while we were busy with the project and conducting a demonstration, HDA, we realized that we actually need something in between these two. Because we started off with an a priori logic model, and we thought we had it all figured out. We had the topic was palliative care, so we developed this logic model. We presented it to stakeholders, and then they said, well, there's quite a lot missing in this logic model. because our logic model had been mostly developed based on the existing literature and the experts within our group. But when we asked patients or healthcare providers, they had a number of other components that were quite useful. So what we decided to do was to add those to the logic model, so to the a priori logic model, but we indicated sort of in a different color that these were sort of the components that were added after the stakeholder engagement. And throughout that process, and I don't want to talk too much about that, but we then documented whenever the logic model changed. We said, okay, so this was the a priori logic model based on the literature. So when we consulted healthcare providers, we changed the logic model accordingly, and then when we consulted patients, we changed it accordingly. So documenting and pre-specifying sort of stages where the logic model will change. So this is the idea of the stage logic model. Yeah, so to summarize and to just look at these three again, so the a priori logic model will be developed at the protocol stage of a review to conceptualize and clarify questions. It remains unchanged. The stage logic model then has pre-specified points at which the logic model will change to increase the transparency of the process of logic modeling. And then the iterative logic model will be subject to continuous modification and revision throughout the systematic review until you then get to the final version of the logic model. And this slide just shows you that sort of when to choose which logic model approach. So you can see here that it's also sort of a continuum and of a degree of iteration. So for the a priori logic model, in terms of the scope or the question, we have a more narrow question. We usually use these types of logic models for theory testing. So if you want to look at, for example, the effectiveness of an intervention, whereas for the iterative logic model, it's probably more suitable for a broader question where you want to generate theory and look at multiple types of evidence. In terms of the nature of the pico elements and the complexity, so the a priori logic model might be more suitable for a tightly prescribed intervention and where the pico elements are well defined, also where you can anticipate the issues of complexity. So you sort of have an idea of where the complexity lies, in comparison to the iterative logic model where the intervention is a complex intervention package. The pico elements might be less defined and you're not really sure where the issues of complexity lie. So you need to build on what you have in the beginning. Sorry. And in terms of timeline and feasibility, so usually with the a priori logic model, you could have a tight timeline and limited resources that you say you don't have the time to then adapt the logic models. And with iterative logic modeling, you always have to constantly work on it, and you need quite a lot of resources. So this is just to show you, in a nutshell, how you can sort of look at the various approaches and when to choose which type of logic model. Which approach to logic modeling. Because now I get to the types of logic models, so not to confuse you with the terminology, but we also have to identify two types of logic models for using for the user in systematic reviews that go across the approaches, so within the approaches, and those are the system-based logic model and the process-orientated logic model. And I'm just quickly going to describe these two types of logic models. So the system-based logic model really aims to look at the whole system in which the interaction between the participants, the intervention, outcomes, and the context takes place. So it's a holistic perspective, or if you want to call it a bird's eye view of the whole system, and sometimes referred to as a sort of a conceptual framework. And it is quite suitable for broad packages or approaches to healthcare delivery, for public health or health systems interventions, where the intervention really has quite a lot of components, and the context plays quite a big role. So just to say that the types of logic models, the system-based and the process-orientated logic models, have been described in the publication in the Journal of Clinical Epidemiology. So the system-based logic model really aims to look at the whole system in which the interaction between the participants, the intervention, outcomes, and the context takes place. So it's a holistic perspective, or if you want to call it a bird's eye view of the whole system. And it is quite suitable for broad packages or approaches to healthcare delivery, for public health or health systems interventions, where the intervention really has quite a lot of components, and the context plays quite a big role. So just to say that the types of logic models, the system-based and the process-orientated logic models, have been described in the publication in the Journal of Clinical Epidemiology. So part of our work was to really develop sort of a template for for logic models, because a lot of authors came to us and said, well, logic models are great, and you know, I can see that they can be quite helpful, but where do I start? I don't know where to start with developing a logic model. So we thought maybe it would be helpful if we just have sort of a template that's not a straitjacket. It's just sort of to get the thinking going on how to develop logic models. And we developed a template for a system-based logic model, which is the one that you can see on this slide, and then one on the process logic model that I will get to now. So for the system-based logic model template, really, we have a box for each of the PICO elements. So for the participants, for the intervention, and then for the outcome. And you can see that we added sort of headings or categories to prompt authors to think about certain things. So the idea would then be that the review team populates this logic model template accordingly. And for complex intervention, we said, well, in terms of describing the intervention, you usually look at, so what was the theory behind the intervention or the aim of the intervention? How was it designed? So what are the components? And there we said, well, there can be various types of components. It might be technology and infrastructure, it might be in education, it might be policy and regulations. And then also, how was the intervention executed? So there might be variations in duration and timing, or dose and intensity, all these things that you need to consider. In terms of intervention delivery, it's who delivered the intervention, how was it delivered, and where was it delivered. So that can also play a role in the whole system. In terms of the outcomes, we wanted to prompt authors not to just think about the health outcomes, but maybe some of the intermediate or process outcomes, health outcomes in terms of individual level health outcomes, as well as non-health outcomes. And then, importantly, also to consider the implementation and context of an intervention. So not to consider the PICO elements sort of in a vacuum, but really to think about these aspects as well. I will talk about a few examples in a while, so it might become more clearer than when I show you the examples. But let's just first think through the process-orientated logic model. So in contrast to the system-based logic model, the process-orientated logic model really just looks at the causal pathways that lead from the intervention to its outcomes. So it really focuses on how the intervention operates. And some people might refer to it as an analytical framework. And it can be used in addition to a system-based logic model. You can also have logic models that have elements of both. You can also have logic models that have some elements of the system-based logic model and some of the process-orientated logic model. So it's really not an exhaustive template. It's just designed to actually start the thinking process. So this is a template for the process-orientated logic model. I know it's quite a busy template, but it's basically just to show you that there are various options of how an intervention can exert its effect. And I'm not sure that these are not all the options, but just to show you that in option A, we might have an intervention that has various components, that has a direct effect and then leads to the outcome of interest. In option B, which is a bit a longer pathway, where we have a direct effect, an intermediate effect, and then the ultimate outcomes. In option C, we have the direct effects and a couple of intermediate effects before we get to the outcomes. And in option D, we have feedback loops that might influence the causal pathway. We can also have sort of relationships between the effects, the intermediate effects. So it just or the intervention components for that matter. So it just shows that there are various options that you need to consider in terms of the pathways. So how do you then develop a logic model? So I said that, you know, we can use the templates as a starting point. You can also use existing logic models as a starting point. You can adapt existing logic models, or you can just adopt existing logic models. But if you want to develop new logic models, it really is an iterative process. It takes quite a lot of time to get it right. And if I say get it right, I mean get it right within the author team so that everybody's on the same page, and everybody agrees that the logic model is sort of a reflection of the assumptions within the author team. So there will be a lot of discussions with the research team. You will also consult content experts, because they usually have quite valuable insight into the question. Looking at existing literature, so doing sort of informal literature searches to inform the logic model, and talk to other stakeholders, policymakers, or patients or healthcare providers, whoever your stakeholders might be, to inform the logic model. So this can take quite a lot of time, but I must say that in the end, up to now, my experience with logic models was that every time it was really, the time we invested was really time well spent, because a logic model really is quite useful in most systematic reviews of complex interventions. Okay, so this is sort of the background and the more theoretical part, and so I will go through some of the examples now, and these are all examples where I've been involved in developing the logic models. So the first one is a systematic review that we conducted with the Campbell collaboration on e-learning of evidence-based healthcare to increase evidence-based healthcare competencies in healthcare professionals. And for this review, we actually developed a system-based logic model as well as the process-orientated logic model. So this is quite a nice example to show you how the one differs from the other in terms of looking at the same question. Sorry, and I will first go through this one and then look at the process-orientated logic model. Sorry. So I don't want to bore you with going through all the detail of this, but just to show you that in terms of the intervention, and in this case, the intervention was e-learning of evidence-based healthcare, we really had to think through, what is it that we're looking at? And we said, so as part of the intervention components, we're looking at courses, modules, workshops, and then importantly, learning objectives and content that actually speak to evidence-based healthcare competencies. We also realized that there might be multifaceted interventions and single interventions, and that then how the intervention and the execution of the intervention would differ quite substantially between studies. In terms of e-learning, because e-learning is really such a broad term, we really had to think, so how are we going to categorize the various e-learning interventions? So we thought of the dimensions of e-learning. So and we pre-specified that we're going to look at pure e-learning, where there's no face-to-face component, as well as blended learning, because where e-learning is or learning happens as part of e-learning and face-to-face learning. Then we have other dimensions where there's collaborative or interactive learning versus individual learning. We also have synchronous versus asynchronous delivery. So, so there's quite a lot of things that we had to consider in terms of e-learning. We also looked at who delivered the content and then where it was delivered. In terms of the outcomes, so you can see these are the outcomes that we pre-specified. I'm not going to go through those in detail now. But what I wanted to highlight was that the context, in terms of the template, the context always relates to, or mostly relates to where the outcomes are occurring. So, so the ultimate outcomes in terms of individual health outcomes will obviously be part of the. We obviously need to consider the healthcare context. So it will also depend on the on some socioeconomic, on the health system, and so forth. So this was important to consider in terms of the health outcomes, but in terms of the educational interventions, we had to consider the educational context. So already you can see that we adapted the template to say, well, we can't just look at the healthcare context, we need to look at the educational context as well. And these turned out to be quite important aspects to consider. So where the learning took place, what the learner background was, what the socioeconomic context was in terms of access to internet and affordability of e-learning, availability of electricity, and so forth. So this was quite useful to get sort of a holistic view of the system that we were considering. In terms of how this added value to the systematic review, so it was really useful in clarifying the question. As I said, it really helped to think through the heterogeneity or the potential heterogeneity, and then also to define the subgroups. We really based our data extraction form on the logic model, and also how we describe the interventions and group the interventions, because there were so many various components of the interventions. And then also it helped us to present the findings. So our comparisons in the systematic review were then e-learning compared to no learning, e-learning compared to face-to-face learning, and then e-learning compared to blended learning or other forms of e-learning. And as I said, it really helped us to look at both the educational and the health context. So if we then look at the process-orientated logic model for this systematic review, you can see there that the intervention that we're looking at was evidence-based healthcare teaching and learning, and in this case it was e-learning. So the direct effects of this is basically increased evidence-based healthcare knowledge, skill, and then attitude. And only then does that lead to increased evidence-based healthcare behavior, which is, for example, reading literature and formulating questions and critically appraising studies and so forth, which then only leads to evidence-based practice or implementation of evidence-based guidelines and adherence to evidence-based guidelines. And only then do we get to the ultimate outcome that we actually want to achieve with evidence-based healthcare, which is improved healthcare delivery. And you can clearly see that evidence-based healthcare teaching and learning, you can't just say, you know, we want to improve healthcare delivery, because there's so many intermediate effects that you need to take into consideration. And as you can see, we also built in some feedback loops, because we said, well, once you start reading more and formulating more questions, you obviously will have a more positive attitude, and so forth, and your knowledge will increase. And that again will lead to more reading, and then being able to then actually practice in an evidence-informed way in the clinical setting. So how did this then help our systematic review? So it helped to explain what we were looking at in terms of the intervention and the ultimate outcome and aim of evidence-based healthcare. It also helped us to decide on the important outcomes, and then to interpret the findings, especially when identifying gaps in the evidence. Because what we found, I'm just going to go back, is that I think 80% of the studies only looked at knowledge and skill. Some looked at attitude, and then really only 4 or 5, can't remember right now, looked at evidence-based healthcare behavior. So you can really see that, I mean, can we say that the increase in knowledge after an intervention then really leads to that improved healthcare delivery? And I think that is where then it was quite useful to refer back to our logic model and to say, look, most of the studies looked at this level of the outcomes, and we really need to look at other studies, or we need to conduct studies to look at how it influences healthcare delivery. The process-orientated logic model also complemented the system-based logic model. And maybe just to go back to the system-based logic model, if you remember that I talked about the educational context, sorry, is that we also realized and found that most of the studies that were conducted did not describe the educational context. So we had very little information, and although we thought this is such an important factor that can influence learning, and studies did not report on the educational context. So in that sense, again, we were able to refer back to how we conceptualized the review and how we interpreted the findings. Right, so a second example is a Cochrane review on interventions to reduce ambient particulate matter air pollution and the effect on health. And sorry, this is really the protocol that was published. Again, we developed an a priori logic model, and we used the system-based logic model template to develop that. And you can see there that if you think of interventions to decrease air pollution, I mean, there's quite a lot of interventions that that you can include in a review like that. And you can see it's quite a broad question. And I think importantly in this system, in this logic model, is how we documented and reported and thought about the types of interventions, the components, and really the logic model helped us to categorize these in technology and infrastructure. We looked at vehicular sources, industrial sources, residential sources. There's also some training and public information, and then also policy and regulation. So these are all quite different interventions, but they all are part of interventions to reduce air pollution. And I think for this systematic review, it was also important to look at the context, because the interventions are quite different in various contexts. So maybe not to spend too much time on that, but as I said, this logic model really helped us to think through various types of the interventions and their components, and also to understand the relationship between the intervention components, the air quality, and the health outcomes. Again, it informed the data extraction, and then also the structuring of the write-up of the review. So we are currently in the final phase of writing up the review. So if you're interested, just keep an eye out. I'm sure it will be published in a couple of months. So the last example that I want to share with you is it's an unpublished example that we a systematic review that we are busy with. And this is a review on integrated models of care for diabetes and hypertension in low and middle income countries, and it's also at protocol stage. So what's interesting about this logic model is that it's not really a system-based logic model, and it's not really a process-orientated logic model, but it's a bit of both. And I think this is, for me, quite an important message, is that the logic model should be based or should address the complexity of your question. So in this question, we were not sure how should we define integrated models of care, because again, if you look at the literature and read up on integrated models of care, there's such a lot out there, and there's so many different definitions, there's different packages, there's different levels, there's horizontal integration, there's vertical integration. So for us, it was really important to be very clear about what our intervention was. Sorry. And this is what we tried to depict in the logic model. So we were looking at people that had comorbidities or multimorbidities, of which one was diabetes or hypertension. And we are looking at integrated care at the point of service delivery. So basically, when somebody enters the healthcare system and is receiving treatment for one condition, which is depicted in terms of the arrow, then there should be parallel, not parallel, but at the same point in time, at the same, sort of with the same healthcare provider, there should be care delivered for another chronic disease. And this can be either just preventative measures, it can be diagnosis of another condition, or it can be treatment, or it can be all of those. And this is what we try to show there. So partial integration of care, full integration of care. But in essence, this clearly shows what we are referring to when we say integrated integrated care in terms of service delivery. We also then included a component on who is delivering the care. So in this case, it would be a multidisciplinary team consisting of a couple of healthcare providers. So it could be a team, or it could be one person that takes on the role of the whole team and then is providing care. So as I said, this was really very important in conceptualizing the intervention. Also for us to get a common understanding of the intervention within the author team. We also engaged with some policymakers to make sure that our understanding of the intervention was the same as their understanding. And then it also informed subgroups and comparisons of the review. As I said, this is still unpublished. We are busy submitting the protocol to be published, and then we will be conducting the review, and I can give an update on how the logic model assisted us maybe in a couple of months. But this was quite an interesting process as well. So I just want to highlight that there are some limitations of using logic models or of logic models in systematic reviews. So as I've been trying to say, so the logic model is limited to a specific review question, right? So it does not necessarily reflect the real world. It's the understanding of the author team or the author team's understanding of the question, of the intervention, of the factors that influence the whole system. So that's always just to keep in mind that it's a tool to guide a review, and it should be specific to that review. A logic model can influence how the review is conducted, because a specific author team that develops a logic model might develop it differently than another author team that would look at the same question. So how you develop the logic model can then influence how you conduct your review. But I think the key is to be transparent and to say, so this is how we see the question, this is how we see the world, if you want to say that, and this is how we conduct the review. So it doesn't matter if it's then different, if it would be different if another author team would develop the logic model. I think I've mentioned that it's quite a time-intensive process, and it can sometimes delay the systematic review process, but it is really very useful, and I don't think that should be the main, you shouldn't not have a logic model just because it's time-intensive. I think it's quite useful. Then there might be overcrowding of the logic model, which basically then makes it too complicated, and I think one always has to be quite one has to pay attention not to overcrowd it. It should be quite simple. You can always add some text and some explanation as part of the logic model, but yeah, keep it simple. And I think I've mentioned some of the lessons learned and practical tips, but just to highlight that it's really about keeping it simple. Logic models should not be too complicated, and it shouldn't confuse people. It should actually clarify the concept. So we've also had that where logic models were too confusing, and we had to just simplify it again. And I think that's quite an important thing. Just keep it simple. So I always say that when somebody comes into your office and says, I don't understand this intervention, or I don't understand this question, you go to your whiteboard, you use a marker, and you draw some pictures in order to explain to the person what it is that you looking at. And that's, for me, the main purpose of a logic model. Yeah, okay, I'm not going to go into detail. There's no quick fix. It does take time. And it takes a lot of iterations. And what I usually do is I just use paper and a pencil, because most of the times I have quite a lot of drafts. There's lots of iterations, but keep track of your drafts, because sometimes you have quite good ideas, then you think, no, I'm going to abandon those, but in the end you get back to them. So keep track of your drafts, and until you have your final sort of first draft. Yeah, and I think I also said that the templates were developed as a tool. They can be useful, but they are no straitjacket. So it's basically a starting point that you can use. There is no right or wrong. A logic model should be helpful, and you can, yeah, as I said, you can add components, you can take away components. There's definitely room for improvement, and as long as you can substantiate and explain your logic model, I think there's no right or wrong. Okay, so now I've done a lot of talking, and I hope it's been useful. And if you have any questions, then this would be the time to ask them.
Thank you so much, Anke. Just to remind everyone, if you want to ask a question, you can either click on the little hand icon to raise your hand, and then I will unmute you so you can ask the question, or you can type your question in the question box, and I will read that out to Anke. I have two hands up. So the first one is Neo Morahele. Do you want to ask your question?
Hi, can you hear me okay?
Yes.
Yes, we can.
Thank you. Thank you. That was extremely useful. So I just wanted to find out if you are available to assist teams to work on developing logic models? Is that something that you would provide as a service, researchers?
I can
Because I'm
definitely,
thinking
yeah.
we're about to, we're in the process of developing a protocol for a systematic review. And this actually is very, very useful, I think. And so I'm thinking of going back to the drawing board and starting by having a logic model to guide our review. So would you be available to assist our research team to develop our logic model?
Yes, I would be happy to do that. So if you, I think my email address is on the front of the slide. So happy to help you with that.
Okay, maybe offline we can speak some more about potential assistance.
Definitely.
Yes.
So you can just send me an email and then, yeah, we can talk.
Thank you.
That's great. Thanks. And I think the other person that we have raised hand is Chikondi Wandera. Chikondi, do you want to ask your question? Okay, I see that you actually posted a question to the question panel. So Chikonji's question, Anka, is he wanted to find out how a logic model can inform the inclusion and exclusion criteria in conducting systematic reviews.
Okay, so how can it help to inform the criteria for systematic reviews? I think it can help through the process of thinking through the components of an intervention, how the intervention is delivered. I think that will all then inform, the type of intervention that you will include. For example, if you think back to the example I had on the integrated models of care, so we said that any intervention that sort of looks at integration in terms of any part of the care pathway, so it can be either prevention or diagnosis or treatment or all of those. So those would then be our criteria for including studies. So if you don't have the logic models, we can just say any integrated model of care would be included. But what does that actually mean? And what is integrated care? So somebody might ask, so what about I have a diabetes clinic and we do HIV testing. Does that mean that that's integrated care? And we've thought about that and thought, well, that's partial integration of care, and that is also something that we want to include and look at. So in terms of criteria for included studies, the logic model then informs our criteria for the types of interventions to say that any intervention that looks at partial or fully integrated service delivery. So I hope that sort of clarifies in terms of your question.
Thanks, Anka. The other question was from Frederick Morfo, who's asking, can logic models be used in reviews of systematic reviews?
Definitely. I think I think logic models can be useful in overviews because again, it's sort of probably more to conceptualize your review and your overview. But they definitely can be used in overviews of systematic reviews as well.
Thank you. And then we have a question from Agnes, who's asking, is there a difference between a logic model and a theory of change?
Yeah, so logic models are often used to explain the theory of change. So yeah. So yes, there is a difference because the theory of change, how can I explain this? So the logic model is often used, especially sort of the process-orientated logic model, to explain the theory of change. So how the process works, how the causal pathway works, how the effects, the intervention generates the effects, and then the ultimate outcome.
Okay, thank you. We've got we've got a hand raised from Shikwendo, but before that, I have a few questions that are asking whether we're going to share the slides, and we will share the slides of the presentation with all participants. So I'm going to unmute Shikwendo. Go ahead and ask your question.
I think my question has been answered.
Oh, okay. So then we have Dr. Jody Mbuilu. I hope I'm saying that right. Go ahead and I'm trying to.
Yes, that's right. Jody Mbuilu.
Okay, go ahead.
Yeah, my question is, I didn't quite understand the difference between a staged logic model and iterative logic model. Should we say that iterative logic model is just an unpublished stage logic model where the endpoint you don't actually put all the specific point where changes has been made?
So I think, sorry, we need to look at a staged logic model on the continuum from an a priori to an iterative. So an iterative logic model, you will probably publish the endpoint of your final logic model, right, at the end of your review. But sort of the iterations happen sort of in a fluid way. So there's no real time points where you say, okay, now we're going to change the logic model. It's just sort of a continuous process of incorporating the new insights and the new findings in terms of your studies that you include and your understanding of the whole system. But with a stage logic model, we say, well, maybe you start with an a priori logic model, and then you specify that you will be doing stakeholder engagements, and then you will change your logic model. You will be doing consulting with patients, and then the logic model will change again. So you basically just pre-specify. So it's sort of to increase the transparency in how and why the logic model changed. Does that make sense? And I might want to refer you back to that paper, and it might become clearer when you read the paper.
Thank you.
Thank you. There's just somebody asking if they can email you with questions if they have some.
Definitely, no problem.
Okay. Any other questions? Okay, there's a question from Moriam, who's asking, do you put all the different logic models developed at each stage of a stage logic model?
Mm-hmm.
So
I think it's very important to keep a version control and an audit trail of of the stage logic model as well as the iterative logic model. And I think it's up to you how many. So sometimes it's very useful to show the process of developing the logic model and how the various inputs actually informed and changed your understanding. But sometimes you can't really publish like 5 versions of your logic model. So what some people do is that you say, maybe I'll publish the first initial framework that we started off with, and then maybe one in between, and then maybe the final one. You can always put the other versions in supplementary files, but I don't think it's always feasible to publish all the versions. But do keep a trail, and I think it's good to have those in supplementary files.
Great, thanks, Anke. Any other questions We have a couple more minutes before our time is up. Okay, here's a question from Marianne. I've muted you, Marianne.
Yes, hi. Can you hear me?
Yes. I can hear you well.
Okay. Anke, I was just wondering, do you know of any instances where author teams have made use of existing logic models and adapted existing logic models?
I think there are some. So I know of there's. I think in some Cochrane reviews where there's a logic model on related to nutrition actually, but I can't remember the details of the question or the topic. But there's definitely some people that use sort of existing logic models. I think in this instance, it was actually an author team that developed a logic model of a topic related to nutrition that was sort of a broader overview, and then had various reviews that actually spoke to the same sort of logic model. But I haven't come across, cases where people just use existing logic models, but that doesn't mean that you can't do that. For me, it's just that if you use a logic model, as I said, it's so specific to your question and your author team's understanding and assumptions of how, the system works and what the question is that, I think it might be difficult to use somebody else's logic model, if I can say that. But you can always adapt logic models, or like I said, it doesn't mean that you cannot use other, existing logic models. It might just, for a specific question, it might be, relevant, and there's no, you can definitely use it.
Okay, thanks.
Okay, thank you, Anke. So if there are no more questions, our time is up. Thank you, Anke, so much for giving us this presentation. It was very interesting. And thank you, everybody who attended. I hope it was useful and informational for you.
Thank you so much for the opportunity, and it was great having you all here on the webinar.
Thank you. Bye-bye.
Bye.